today taken this topic of heart attack. So you will be seeing the newspapers, young fellows are dying, particularly in the middle age group, 30-40 years. So దానికోసమే ప్రతి సంవత్సరం కూడా apart from other diseases we have taken this topic as a primary event. So మనకంతా తెలుసు generally the heart is supplied by the two arteries, that is right coronary artery and left coronary artery. So this is the right coronary artery which supplies the most of the right side, right ventricle and also right atrium and also part of the left ventricle. So the left side there is again left vein and the left antidescending artery and the circumflex artery. So the left antidescending artery supplies 75% of the left ventricular myocardium and circumflex artery also supplies the left ventricle. So the any body to sustain మనకు రక్త ప్రసరణ జరగాలి. సపోజ్ లింబుకు సో బ్రేకియల్ ఆర్టరీ, అప్పర్ లింబ్ లో బ్రేకియల్ ఆర్టరీ, ఫిమరల్ ఆర్టరీ ఫర్ లోయర్ లింబ్. సో ఆర్టరీ బ్లాక్ అయితే ఏమైతుంది, ఇట్ విల్ బికమ్ ఏ గ్యాంగ్రీన్స్. సో హార్ట్ అటాక్ బేసికలీ ఇట్ ఇస్ అక్యూములేషన్ ఆఫ్ ఫ్యాట్ ఇన్ ద కొరోనరీ ఆర్టరీస్. చాలా మందికి హార్ట్ అటాక్ అంటే హార్ట్ సడన్ కార్డియక్ డెత్ మామూలుగా జరుగుతుంటుంది. కొంతమందికి విల్ బి సీయింగ్ వాట్ ఈస్ హార్ట్ అటాక్ అండ్. So in this picture, you see the గుండెకు ధమనుల్లో రక్తనాళాల్లో so there is a fat accumulation జరుగుతుంది. So there is a fat accumulation అంటే మనకు 20 ఏళ్ళ నుంచి 20 years adolescent ఏజ్ గ్రూప్ నుంచి మనకు ఫ్యాటీ స్టిక్స్ అని మనకు బయటపడుతుంటాయి. మామూలుగా సెకండ్ వరల్డ్ వార్, కొరియన్ వార్లో సోల్జర్స్ చనిపోతే వాళ్ళకంతా పోస్ట్ మార్టం ఎగ్జామినేషన్ చేసి ఐవటాలో తెలిసే ఇనిషియల్ లీజన్ ఫ్యాటీ స్ట్రిక్. ఈ ఫ్యాటీ స్ట్రిక్ ఇది బ్లాక్ అంటారు. సో దీంట్లో రప్చర్ ఆఫ్ ది బ్లాక్ పార్ట్ హెమరేజ్ ఇన్ ద బ్లాక్. ఇదైతే ఇట్ ఫార్మ్స్ ఓపెన్ అయిపోయి ఇట్ ఫార్మ్స్ థ్రాంబస్, దట్ ఈస్ కలెక్షన్ ఆఫ్ బ్లడ్ సెల్స్ అండ్ వైట్ నోజల్, సమ్టైమ్స్ ప్లేట్లెట్స్. దట్ ఈస్ if artery is completely blocked like this, so get a heart attack. So this is the this one. And sometimes smokers lo spasm అంటే మొంచుకొని పోతుంది, కంప్లీట్ గా బ్లడ్ సప్లై ఉండదు. అందుకనే చైన్ స్మోకర్స్ లో ఈ ప్రైమరీ స్పాస్మ్ ఇస్ కామన్. ఈ కొంతమందికి 80% బ్లాక్ ఉంటుంది, 75%, 80%. అంటే ఇది వీళ్ళలో నార్మల్ గా దే విల్ నాట్ బి ఎనీ పెయిన్. జనరల్ గా వాళ్ళు ఎగ్జాక్ట్ అయినప్పుడు వాకింగ్ ఫర్ distance or any supplementary course or climbing stairs, they get a pain that is called angiogram. So that is a first warning symptom మాదిరి వస్తుంది. సో ఈ ధమని మామూలుగా సో దిస్ ఇస్ atherosclerosis that is taking place. If it is rupture into the this one forms a platelets avanta kuda aggregate అయితాం. So it forms a thrombus like this. So this will completely block. And once it is blocked, the vessel which is supplying that area, myocardium, it will be lost and people will be getting a severe chest pain రావడం జరుగుతుంది. సో ది angina జనరల్ గా మనకు మామూలుగా రెగ్యులర్ వాకింగ్ చేసే వాళ్ళకు 2 kilometers, 3 kilometers there. After 2 furlongs, if they get a chest discomfort, if they take rest for 2 to 5 minutes, the pain will come down, or sometimes arbitrary చేసుకుంటే తగ్గడం వల్ల స్టార్ట్ చేయడం. దట్ ఈస్ ఫస్ట్ వార్నింగ్ సిమ్టమ్ ఆఫ్ హార్ట్ అటాక్. సో చాలా మంది మనం చూస్తుంటాం ఇది గ్యాస్ ప్రాబ్లం అనేది చాలా మంది నెగ్లెక్ట్ చేసుకుంటా సడన్ గా ఒకసారి వన్ డే దే విల్ బి అరెస్టెడ్. సో ది జనరల్ గా ప్రెజెంటేషన్ వచ్చేసి ది 50% ఆఫ్ ది కేస్ ఆఫ్ హార్ట్ అటాక్స్ they come with an acute MI, that is severe గా నొప్పి రావడం. దీన్ని ఎస్టీ ఎలివేషన్ MI అంటారు. అంటే దీన్ని స్టెమీ ప్రోగ్రామ్ అనేది మన ఆంధ్రప్రదేశ్లో కూడా స్టార్ట్ చేసాం, బట్ తమిళనాడులో స్టార్టెడ్ లాంగ్ బ్యాక్. సో ఈ స్టెమీ అంటే డిపెండింగ్ అపాన్ ది పేషెంట్ చెస్ట్ పెయిన్ వస్తే మనం ఈసీజీ తీస్తే కానీ మనకు తెలుసు అన్నమాట వెదర్ ఇట్ ఇస్ ఎస్టీ ఎలివేషన్ MI or a non-escalation MI or a unstable MI. So the escalation MI అంటే మామూలుగా మనకు ఈసీజీలో మనకు చేంజెస్ తెలుస్తుంది. దిస్ క్యారీస్ బ్యాక్ ఉంటుంది. ఇన్ 25% ఆఫ్ కేసెస్ ఈ నాన్ స్టెమీ అంటే చెస్ట్ పెయిన్ ఉంటుంది, 20 to 30 minutes ఉంటుంది. ఈసీజీలో ఇవే చేంజెస్ ఉంటుంది. కొంతమందికి దీంట్లో ఈ రెండింటి కండిషన్స్లో మనకు డ్రాప్ టీ టెస్ట్ చేస్తాం, బ్లడ్ టెస్ట్ డ్రాప్ టీ. దట్ ఈస్ once the patient has come to chest pain, we will do subject the patient for drop A, drop T will be positive in this case. The third category is unstable. They come with the chest pain, but దాంట్లో మామూలుగా మనకు డ్రాప్ టీ will be negative. These patients ఒక 2 days observation చేసి will be discharging the patient. సో ఎందుకని హార్ట్ అటాక్స్ ఇండియన్స్లో మనం చూస్తుంటాము. ఈ యంగర్ జనరేషన్ ఆర్ అఫెక్టెడ్, పర్టికులర్లీ అర్బనైజేషన్ వల్ల చాలా మంది పల్లెటూరు నుంచి పట్టణవాసులు కలిసిపోతున్నారు. జీవన లైఫ్ స్టైల్ మోడిఫికేషన్, జీవన విధానం మారుతుంది. యంగ్స్టర్స్ మామూలుగా మనం పిజ్జా బర్గర్లు ఫాస్ట్ ఫుడ్స్ తినడం వల్ల కూడా ఇది అవుతుంది. లైఫ్ స్టైల్ మోడిఫికేషన్ అంటే పల్లెటూరులో చాలా కష్టపడుతుంటే ఇక్కడికి వచ్చిన తర్వాత హైపర్ టెన్షన్ లెవెల్స్, బీపీ లెవెల్స్, బాడీ మాస్ ఇండెక్స్, దట్ ఈ ఒబేసిటీ కూడా పెరుగుతుంది. ఆల్మోస్ట్ 20 to 30% ఆఫ్ ది అర్బన్ ఏరియాస్లో. సో దీనివల్ల మనకు ఫ్యాట్ అక్యుములేషన్. తర్వాత ఇండియన్స్లో దోస్ ఆర్ బర్త్ weight if is less than 2.5 kgs, they are more prone for getting heart attacks and atherosclerosis in the late age group. తర్వాత the rice is also responsible. Indian diet particularly we take lot of rice. So this has to be avoided. And various risk factors, modifiable risk factor, non-modifiable, అంటే ఏజ్ వల్ల. తర్వాత సెక్స్, పర్టికులర్లీ మేల్స్లో ఎక్కువ ఉంటుంది. మామూలుగా ఫిమేల్స్లో దే ఆర్ ప్రొటెక్టెడ్ ఫ్రమ్ ద హార్ట్ అటాక్ బిట్వీన్ ద మినారిటీ టు మెనోపాజ్. అంటే 12 సంవత్సరాల నుంచి 45 సంవత్సరాలు 50 సంవత్సరాల వరకు దే ఆర్ ప్రొటెక్టెడ్ ఫ్రమ్ హార్ట్ అటాక్ బికాస్ ఆఫ్ ది ఈస్ట్రోజెన్ అనే హార్మోన్. దీనిలో it increases the good cholesterol, HDL level cholesterol, decreases LDL cholesterol. Males, what is the hormone responsible? Testosterone. So the testosterone hormone, it increases the bad cholesterol, LDL cholesterol, and decreases the HDL level cholesterol. So that's why. But if the woman is a diabetic lady, even 30-35 years లో కూడా మధ్యకాలంలో మనం చూస్తుంటాము హార్ట్ అటాక్స్ వచ్చే అవకాశం ఉంటుంది. Above 45, every woman, particularly children like you should ask your mothers to have a checkup. So recently, the journalist Devishetty was telling that even doctors, the prevention has to take place from age 1 year. So you should not feed your children with lot of ice creams and all that. So the prevention should start from the age 18 years. At least 18 years లో ప్రతి ఒక్కరు కూడా you should go for a checkup for blood sugar, cholesterol levels, these things. So these are the anyhow and also genetic factors. Family members లో genetic factors లో father, mother, తర్వాత brothers ఏమన్నా ఇవి ఉంటాయి. Modifiable risk factors అన్నీ ఉన్నాయి మనకు. స్మోకింగ్, particularly smokers లో 5 to 10 fold increase of heart attack, blood pressure, BP ఉన్నోళ్ళకు, ఊబకాయం ఉన్నోళ్ళకు. తర్వాత డయాబెటీస్, పర్టికులర్లీ సాధారణట్లు డయాబెటాలజీ ప్రాక్టీస్ ఆల్మోస్ట్ డయాబెటీస్ ఉందంటే హార్ట్ అటాక్ ఉన్నట్లే. సో కొరోనరీ ఆర్టరీ డిసీజ్ ఆల్మోస్ట్ 30 to 40% రిస్క్ ఉంటుంది. సెడెంటరీ లైఫ్. తర్వాత రీసెంట్గా ఈ సమ్ ఆఫ్ ది హోమోసిస్టమ్ లెవెల్స్ ఈ మధ్య ఆల్మోస్ట్ 1 week బ్యాక్ వన్ యంగ్ బాయ్ ఆల్మోస్ట్ 22 years వాజ్ అడ్మిటెడ్. ఏ రిస్క్ ఫ్యాక్టర్స్ లేవు, సివియర్ హార్ట్ అటాక్ రావడం, యాంజియోగ్రామ్ చేస్తే దర్ ఇస్ 90% బ్లాక్ అంటే థ్రాంబస్ ఉంది. సో బికాస్ ఆఫ్ ది హోమోసిస్టమ్ లెవెల్స్ ఎక్కువ ఉంటే హైపర్ హోమోసిస్టమీ అంటారు. దాంట్లో హోమోసిస్టమ్ లెవెల్స్ ఎక్కువ ఉంటే గెటింగ్ వాస్కులర్ థ్రాంబోసిస్ వస్తుంది. సో ఇన్సిడెన్స్ ఆఫ్ హార్ట్ అటాక్ ఎక్కువ. సో దట్స్ వై యూ హావ్ టు బ్లాక్ ది ఇన్ఫెక్షన్స్. పర్టికులర్లీ కోవిడ్లో చాలా మంది మనం చూస్తున్నాం యంగ్స్టర్స్ కూడా హార్ట్ అటాక్తో చనిపోవడం జరిగింది. సో దిస్ ఆర్ ఆల్ ది దిస్. సో జనరల్గా హార్ట్ అటాక్ మనకు చెస్ట్ పెయిన్ మాత్రం వస్తుంది. సమ్ టైమ్స్ కొంతమందికి ఆయాసం రావడం, అంటే కొంతమందికి డయాబెటిక్ పేషెంట్స్లో జనరల్గా నొప్పి రావడం, ఆయాసంతో రావడం. తర్వాత స్వెటింగ్, ఎనీ పేషెంట్ కమ్స్ సివియర్ చెస్ట్ పెయిన్ sweating and radiating to the both arms ఇది వస్తే డెఫినెట్గా హార్ట్ అటాక్ అండ్ నాసియా, వామిటింగ్, అర్జ్ టు పాస్ మోషన్ అండ్ యూరిన్ అంటే ఒంటికి వచ్చినట్లు రావడము, మోషన్ వచ్చినట్టు రావడము, బాత్రూమ్ పై లాక్ చేసుకుని సడన్గా ల్యాబొరేటరీస్లో చనిపోతుంటారు. మనం చూస్తున్నాం చనిపోవడము, ల్యాబొరేటరీస్లో చనిపోతుంటారు. స్టేజ్ రావడం, డిక్రీజ్ ఎఫర్ట్ టాలరెన్స్, సివియర్ వీక్నెస్ అంటే పెయిన్ అనేది యాంగర్ ఎనిమే అంటారు కండిషన్, ఫీలింగ్ ఆఫ్ ఇంపెండింగ్ డెత్. He will feel that he will tell to the wife that I am dying. Such is a severe pain in the heart attack. So this is the different symptoms: chest pain, రావడం, sweating రావడం, severe weakness, sweating రావడం ఇదంతా. If any person comes like this, fist over the chest, so it is invariably heart attack. Invariably, this is called Levine sign. Levine sign as designed. So the pain మామూలుగా సబ్స్టోనల్ రీజన్ లో ఉంటుంది. సో సమ్టైమ్స్ రేడియస్ టు ద బోత్ ఆర్మ్స్, తర్వాత నెక్. సో ఎనీ పర్సన్ కమ్స్ విత్ డిస్కంఫర్ట్ అండ్ చెస్ట్ అండ్ రేడియేషన్ టు ద యాంగిల్ and even to the epigastric region. Sometimes pain and pressure in the back. Sometimes they go to a dentist. Sometimes they go to a orthopedic surgeon. And the రైట్ కొన్ని అటు ఇన్వాల్వ్ అయినప్పుడు ఎపిగాస్ట్రిక్ డిస్కంఫర్ట్ బాగా వస్తుంది. చాలా మంది గ్యాస్ ప్రాబ్లంలోనే ఒకసారి ఎండోస్కోపీ చేస్తున్నప్పుడు కూడా చనిపోవడం జరుగుతుంది. సో దిస్ ఇస్ ద థింగ్ యూ హ్యావ్ టు కీప్ ఇన్ మైండ్. పర్టికులర్లీ ఫిమేల్స్లో, ఆడవాళ్ళలో టిపికల్ చెస్ట్ అంజైనా రాదు. వాళ్ళలో వేగ్ డిస్కంఫర్ట్ రావడము అంటే లేట్ టు బి రికగ్నైజ్, అంటే పిల్లలు కానీ హస్బెండ్ కానీ ఏముందలేవే నీకు అట్లా డిలే ప్రెజెంటేషన్ ఎక్కువ ఉంటుంది. వాళ్ళ మార్టాలిటీ కూడా ఎక్కువ ఉంటుంది. సో మనకు పేషెంట్ వచ్చిన తర్వాత సో యూ హ్యావ్ టు చెక్ ది పల్స్, బ్లడ్ ప్రెషర్, వెదర్ ద పేషెంట్ హెస్ గాట్ ఏమైనా బ్రాడికార్డియా ఉందా, అది టెకికార్డియా ఉందా, తర్వాత బ్లడ్ ప్రెషర్ యూ హ్యావ్ టు చెక్. సమ్ పీపుల్ పర్టికులర్ ఇంక్యూరబుల్ ఆర్బీఎంఐలో బ్రాడికార్డియా, హైపర్టెన్షన్ ఉంటుంది. సమ్టైమ్స్ దే ప్రెజెంట్ విత్ సివియర్ బ్రెత్లెస్నెస్, ఆల్మోస్ట్ పల్మనరీ అంటారు. దాంట్లో కోల్డ్ క్లైమేట్స్ ఇది చూడాలి. సో దిస్ ఈస్ డిపెండింగ్ అపాన్ ద వన్స్ పేషెంట్ కమ్స్ టు దిస్ వన్ యూ హ్యావ్ టు చెక్ ది ఈసీజీ. మనం ఈసీజీ తీస్తే కానీ మనకు ఈసీజీ ఇస్ డయాగ్నోస్టిక్ ఇన్ అక్యూట్ కండిషన్. దట్ ఈస్ హార్ట్ అటాక్లో ఈసీజీ వల్లనే మనం డయాగ్నోస్ చెస్ట్ ఎలివేషన్ ఆర్ నాన్ చెస్ట్ ఎలివేషన్. సో ఈసీజీలో దిస్ ఇస్ ద నార్మల్ ఈసీజీ జనరల్గా. So one should know as even paramedical this one. So it is just a paper. It was who is the father of electrocardiogram? Is a 1902 lo. So galvanometric method of ECG recognized. So earlier Augustus Desire Waller is recommended, but this man got a Nobel Prize for invention of this ECG in 1926. So nth triangle అని ఉంటుంది కదా, దిస్ ఈస్ ద నార్మల్ ఈసీసీ. సో దీస్ ఆర్ ది వేవ్ ఫార్మ్స్, జనరల్గా పీ వేవ్, పిఆర్ఎస్, టీ వేవ్. సో ఇదంతా కూడా రెగ్యులర్గా మనము చూస్తుంటే కానీ మనకు కార్యాలయ పోస్టింగ్ ఉంటే కానీ క్యాజువాలిటీలో ఉన్నప్పుడు కూడా యూ షుడ్ అబ్జర్వ్ దీస్ థింగ్స్. సో దిస్ ఈస్ అబ్నార్మల్. సో దిస్ ఈస్ ద నార్మల్ ఈసీసీ. అండ్ వెనెవర్ యూ సీ ఏ పేషెంట్ విత్ హార్ట్ అటాక్ అండ్ ఇఫ్ యూ సీ దిస్ చేంజెస్, So Himalayan mountains madri, if you see, this is called acute antivolemite. L1 ABL lo, V12 V6 lo, this is a acute antivolemite, extensive antivolemite. So this has got a immediately patient has to be normalized. So this is a inferior volemite. So you see these changes in L2, L3 ABL and ST segment depression in this relation. Sometimes I was telling you the non-estivation MI-లో దీంట్లో మనకు will have a gesture depression and T-wave inversions ఉంటాయి. This is a T-wave inversions అన్నమాట. సో మనకు ECG until unless you go to this one, if you take this one ECG, you cannot diagnose this one. Now ECG ఏముంది nowadays, even this one everybody wants an echocardiogram. So that awareness has come in this one because of the field in the Department of Cardiac, we started in 2001 with a new modern ICU. So everybody wants every patient is undergoing ECG. You will be surprised to know that even in the government general hospital, Kurnool, every day 500 ECGs will be taken. Every day 500 ECGs are taken, even in this one, and also the echocardiograms. Almost we do around 100 to 120 echoes. And think about the entire private setup and all. So heart attacks, almost 5 to 10 heart attacks every day we are getting for our department. Apart from these private centers, so strokes, heart attacks, brain attacks are equal basically. So there is 17.3 million deaths every year. People are dying of heart attacks and brain attacks. And sometimes you have to see that suppose ECG is normal. So you must admit that when any person comes with severe chest pain, ECG is normal, still you have to get admitted, send the blood sample for the enzymes like trophy, CPK, CKMP. So this one probably will be positive from 4 hours and it will be there for 5 to 6 days, and the CPK, CKMP 2 samples you have to take. So what is the first aid? Even suppose a relative of yours or a neighbor in this one, suddenly chest pain ravadamu, sweating ravadamu. If you think that it is a heart attack, give a Disprin 325 milligrams. Ask the patient to chew the tablet. So in the clopidogrel, almost the Clavix and a tablet, 75 milligrams into the 4 tablets. Ask the patient to chew the tablet. And also statin, atorvastatin, almost 40 to 80 milligrams of the tablet. You give them, ask them to chew the tablet. So these are the 3 drugs one should carry in the household. Basically, any person suspected a heart attack, you should give this Disprin 325 milligrams and the chewable aspirin Disprin. So clopidogrel 75 milligrams to 300 mg, statin almost 300. మన ఇంట్లో you should keep a sorbitrate tablet 5 milligrams or 10 milligrams or a nitroglycerin tablet కానీ అది blood pressure is normal. Suppose the patient is in shock, don't give any sorbitrate sublingually. And sometimes they will be arrested. First 1 hour to 1 to 4 hours is dangerous. So you might have seen people are dying in casualty suddenly, or in the house itself, they complain of chest pain, they just collapse because of the primary ventricular arrhythmias. That is VT or pulseless VT and VFS. After we have to do CPR, give a thumb and shift the patient to nearby hospital where the defibrillator is available. Once you give a shock only, they recover. 200 joules of shock has to be given. So, and we got luckily because of the 108 facility where Rajshekar Reddy garu 2007 lo they started pre-hospital. This one many lives have been saved. Earlier that time in the concept of ICU has come in 1960s in developed countries, whereas in India recently it has started almost 20 years back. This facility has started and somehow the people are getting this one. So as soon as patient comes, give Disprin. Suppose patient is dyspneic, give oxygen at the casualty, take an ECG, give a morphine if the patient is having this one, and if the facility is available, shift the patient to the ICU, or time is muscle. So చాలా మంది మనం చూస్తుంటాం, very important. Time management is very important in heart attack. So first golden hour for thrombolytic therapy is half an hour. Patient should reach to the ICU as early as possible. So more than 6 hours already transmural death, muscle necrosis will be taking place. So the time is a muscle and muscle is the time. So you have to be, and sometimes if the patient is within 90 minutes, within 1.5 hours, patient has to be taken to the cath lab, do angiogram and do a culprit vessel angioplasty care. So this is a PCA, that is percutaneous coronary intervention. Door to balloon time is less than 90 minutes. Door to needle time, అంటే క్యాజువాలిటీకి వచ్చిన పేషెంట్ ఐసీయూకి వచ్చేసి thrombolytic therapy. మనకు వేరియస్ డ్రగ్స్ ఉన్నాయి, స్ట్రెప్టోకైనెస్. ఈవెన్ హాస్పిటల్లో, జనరల్ హాస్పిటల్లో వీఆర్ హ్యావింగ్ ఏ టెర్నిక్ ప్లేస్ దట్ ఈస్ ఎలాక్సిన్ 40 milligrams. That costs about 40 to 50,000 rupees. Know that. So we have been giving this drug in the general hospital free of cost for the past 15 years. So Elaxin is available in the hospital. Poorest of the poor people are getting benefited by this. So, and if the patient is affordable, or if the cath lab is directly taken to the this one, and we can do here this one. So this we should remember mnemonics A, B, C, D, E as subset for aspirin, anti-anginals, beta blocker. And the first day, the low dose of beta blockers with your anti-cholesterol agents, and avoid smoking. So diet is very, very important. Control the diabetes, exercise and education is important. Various drugs are there, like fibrinolytic, radiculation, streptokinase. Streptokinase to just it will come around 1,000 rupees or 1,500 rupees, whereas Elaxin 40,000-50,000 rupees. That streptokinase 15 lakhs in dissolved 100 ml of normal saline. So this is our cath lab, new cath lab, the Department of Cardiology. So this has cost about 5 crores. And initially when I came in 97, I joined. I got 11 years to get a cath lab. In 2008, Siemens cath lab. It has worked for 12 years. Then recently, last year, that is one year, 3 months, and this new cath lab has come. GE has come. So this has got a facility. This is a C-arm. This is a table. This is a monitor where you can see this. You got a voice operators. So emergency even ventilators, everything defibrillator should be there. So when this nowadays it has become a fashion. So once a patient has got admitted, everybody is interested about this angiogram. Every patient has, and they will be very, very furious. Patient admitted or that is an awareness the people have got. That is a good. Actually, patient has got a heart attack, so you have to give a primary treatment, that is first aid, then thrombolytic therapy, then you can subject the patient for angiography. So this is a thing where tube-like structure will be passed and you can this one. So this man, Werner Forsman, 1927 is a German. Believe it or not, he is a house surgeon. When he was doing a house surgeon's internship after MBBS, so he got an idea. Why don't he himself has cut open his basilic vein, passed a ureteric catheter, and went into the downstairs where the radiology department was there. First X-ray was taken. So 1927. So he has attempted almost 10 times. He was successful 46 times. Why this man has done is basically to give the drugs. Suppose patient arrest happen. So whenever patient is arrested, generally we give a intracardiac adrenaline, third and fourth phase. So when you are doing the injection, so చాలా సార్ ఇప్పుడు అది we are not doing. చాలా మంది సార్ ఇంజెక్షన్ వేస్తే సంపూర్ణ సార్ అంటారు. So that is the thing. We have to educate. Whenever the patient has become bad, keep the attendants out, do the procedure. So always say nurse or a doctor, generally whatever the patient is arrested, go for a CPR. And we used to give intracardiac adrenaline. So when you are giving an injection, sometimes you may be lacerating the coronary arteries. So his idea was to give the drugs directly into the heart. That's why he passed a catheter, keep the catheter in position, and they used to inject this one. So this is the first X-ray in 1929. You know this is documentation. At the age of 25, when he was receiving instruction surgery, so this was a X-ray. 1900s lo manaku X-ray vachindi. So that was the first picture where he has cut open his own basilic vein, passed a catheter into the right atrium. So that is the greatest invention. So later, Andrew Murad and Dickinson Richards. So all these three people, they got a Nobel Prize in medicine, particularly in 1956. That is Werner Postman, Coronary and Dickinson Richards. They got Nobel Prize for the invention of this one. How this angiogram, coronary angiogram is done? This is a Mason Jr. in 1958. So he was a radiologist actually. So while doing an angiogram, that is the right root angiogram, the tip of the catheter directly went into the right pancreas. And అంతవరకు there is a feeling of ఇది ఉంటుంది పేషెంట్ coronary arteries ఇంజెక్ట్ చేసి చనిపోయే అవకాశం ఉంటుందని. So this man, when he was doing radiography, so that's why, and for this they used to cut open the brachial artery, open it and put a nick and pass the Stone's catheter running both right and left coronary arteries. They used to do and tell me angio. So this is the method, that is right heart catheterization, particularly if you are going through the vein. Left heart is by the arteries. So there are various types, that is radial angiogram and also femoral angiogram. So this is the approach, radial this one. This is a brachial approach also can be done. This is a femoral approach. Earlier they used to do brachial. So akkada emana suppose if the brachial artery is blocked or thrombus vachindanago, the entire limb will become gangrenous. Ikkada emaitundi, when you are doing the arm, the radial artery and ulnar artery dual supply untundi. So even if one artery is blocked, the ulnar artery also, through ulnar artery the blood supply will be maintained. Generally we are doing most of the cases nowadays by radial angiogram or the femoral angiogram. This is the femoral artery where we have to this one. So this is the radial artery. This is the femoral artery. So this is the how the angiogram. Generally we take the dye that contains the iodine, that is sodium nitrate, IOX, all these things. So once you puncture it,
fix the radial pulse with the help of 3 fingers.
So this is the procedure.
Pulse with the help of 3 fingers of our left hand and with a double wall puncture technique. The plastic cannula needle is introduced at an angle of 45 degrees or slightly higher. Confirm flashback into the plastic hub and push the needle further in.
How the radial angiogram is done. This is
behind the cannula on the wrist for blood cover. Keeping left hand on sight, slowly withdraw the plastic cannula and see for the jet of the blood flashback. Once the jet is seen, insert a short guide wire into the cannula, slowly, watching for resistance to forward push. The plastic cannula is removed over the short guide wire with at least 10 centimeters of wire is left in place.
Keep that guide in that.
An 11-number surgical blade is taken and a small nick is given at the entry of the guide wire on the skin. A 5 French Toruno sheath is introduced over the guide wire with the right hand and slowly pushed forward over the guide wire. Make sure the guide wire is held proximally with the left hand. The guide wire in the left hand is slowly withdrawn back into the radial sheath until it is exited from the back end of the radial sheath for a few centimeters. The sheath is now pushed forward slowly into the radial artery through the skin puncture along with the guide wire with torque. Keep an eye on the guide wire at the back end. Advance the radial sheath forward up to the end of the sheath. Now remove the dilator along with the guide wire from the sheath to leave the radial sheath in the artery. The side port is now to air and checked for free backflow of blood from the sheath. We are now injecting a cocktail of nitroglycerin, diltiazem, and normal saline into the radial sheath with proper precautions. This is given to prevent any radial artery spasm and smooth finishing of the procedure.
Also we give 5,000 units of heparin.
The sheath is now flushed with normal saline to finish. A tiger catheter is now being introduced into the radial sheath under fluoroscopic guidance. The catheter with a long guide wire inside is advanced into the radial artery, brachial artery, and through the subclavian artery into the ascending aorta into the aortic sinuses. While passing the catheter, The guide wire should always be ahead of the catheter tip and make use deep inspiration technique to advance the catheter in different loops in subclavian artery. Once the aortic sinus is reached, the guide wire inside the Tiger catheter is withdrawn entirely and the catheter end is attached to a three-way hub. Are advanced together under fluoroscopic guidance.
This is a procedure.
Take precautions while advancing the catheter. Always the guide wire should be advanced ahead of the catheter, and the catheter should follow the wire. When the wire and catheter have crossed the subclavian artery, advance slowly into the ascending aorta. If any difficulty advancing at this point, use deep inspiration techniques. When the aortic sinus is reached, the guide wire is withdrawn slowly from the catheter. Check for blood flash back from the catheter and connect a three-way hub to the catheter.
But you can now see the pressure.
The catheter is now slowly manipulated to hook the left coronary ostium. Use mild rotational torque and forward and backward movements of the catheter. All the left ostial hooking shall be done under left anterior oblique fluoroscopic position. Once the catheter is hooked, do a small fluoro check and go on to LAO caudal position.
This is a procedure that will be taken by many of you will not be seeing until unless you posted in the cath lab, cardiology and this one. So that's what we are showing you. How there is a lot of apprehension, angiogram and biopsy.
Then give a check shot again and make sure the catheter is hooked in. Check the pressures before going for a CNA fluoroscopic shot. Here we are finally getting a CNA shot.
Then we will be injected with the dye, that is zero graphene or omnipotent, so that we can see the obesity.
Now we have hooked the right coronary ostium and have given a CNA shot. This is a femoral arterial access. We are doing for an angiogram. First, we mark the location of the femoral artery in a femoral triangle and anesthetize the area.
You have to anesthetize with the lid nocket, local anesthetic. Once you give anesthesia, that is a femoral triangle.
Then a femoral puncture needle is used to puncture the femoral artery, and when a clear jet is seen, a short guide wire is inserted and femoral sheath is inserted over the guide wire.
Keep the guide wire, small guide wire like this, then put a sheath with the side on, so that it will prevent the guide leakage. So by this we can know whether it is a single vessel disease or a double vessel disease or a triple vessel disease. So this is a femoral sheath. Through this we will be passing the catheters, right and left catheters, whereas in the radial angiogram only one catheter, both Tiger catheter.
Along with the guide wire is inserted into the femoral sheath and then tracked through the femoral iliac artery. Wire is removed and then angiogram is taken.
So the idea of this one is interventional cardiology. My daughter is the one which is they used to do in animals. So this man Andrews Granchik is also German. In 1977, almost in 1977, first successful angioplasty. Stent PTCA. So this man is invented. He is a German. In the first time he has done in the University Hospital of University of Switzerland. So he is a German who has started this one. So this man, daughter, these people has devised. He has devised his own catheter with a balloon. So whenever there is an obstruction, so this is the balloon angioplasty, how the balloon angioplasty is done like this. So this is the, if the lesion is there, pass this one and So this is a balloon with a stented deployment. So this is a procedure in the department.
This patient was having a disease in the left circumflex coronary
This is
artery.
circumflex
A
artery.
guide wire is passed into the coronary artery and the lesion length is assessed. We are here inserting a non-compliant balloon along the guide wire into the left circumflex coronary artery through the catheter and positioned across the lesion. The balloon is connected to an indeflator device and negative pressure is maintained throughout the system.
These are all the technical values. So we have been doing from 2008 onwards. Both the angiogram
The
and
balloon's position is confirmed from fluoroscopic imaging. Escalating pressures are used to inflate the balloon across the lesion from distal to proximal length of the lesion. Here we can see the inflated balloon inside the stem coronary vessel.
Then the process.
After removing the balloon, we now pass the stent along the guide wire into the stenosed vessel, which is
Stent
directed
is
right.
placed over the
The
balloon.
stent balloon catheter is connected to the indeflator. The drug-eluting stent is positioned across the lesion under fluoroscopy. The stent is positioned and slowly deployed across the lesion by slow inflating the stent balloon. Here we can see the stent being inflated and deployed. These are the stent boost images checked. Here is the final shot where we can see the normal flow after stenting and vessel
This
attain
is the
normal
normal,
anatomy.
it has become a normal vessel after the stent.
This patient was
So the other thing like sometimes you go for a bypass surgery. So take a graft from the subcutaneous artery or this one or a lima internal memory artery graft is also better. So this is the procedure and of course the prevention is very very important. You're taking a healthy diet, physical activity, avoid smoking, height control the weight, control the cholesterol, blood sugars, blood pressure. So the take-home message is take your medication. So once a patient is admitted, you should tell them properly, take the medication regularly, follow for a health checkup, generally cardiac rehabilitation, and if there are risk factors, these to be controlled, and the counseling, regular checkup is required. Thank you. So this is about the what I wanted to inform from the market. So this is the procedure I wanted to tell as a cardiologist how the procedures are done. Almost 15,000 angiograms, almost over 6,000 stents, pacemakers we have done. A significant work is done in the general hospital itself. Because we are also most of the public or the even nurses, you don't have any access to enter to the catheter so that you can see the procedure. And this basically, this foundation is started basically to make the awareness about the heart problems in the society. And that's why we have started. So of course, the 2002 we have started this foundation with increasing the health awareness. More in the start and all these people, Rama, Vilanta, they are founders. 2002, 2011, Club Ground Body, 2012, we have been doing, for the past 12 years, we have been doing the awareness program. So, with this, I thank the Heart Foundation, particularly District Collector. These people are busy, but they should. We have been continuously doing every month. First Sunday is a awareness program on the various topics. So I should be thankful, at least youngsters, particularly nursing staff, BSc people, the general public are utilizing almost 1 to 2%. But I am happy that you people are going to when you go to there after your course, at least you will have an idea about the heart problems, heart attacks. So that's why you should encourage your parents to go for a checkup or get it done. Almost BP gani, sugar gani, cholesterol, until unless you go to your doctor, it is difficult with this one. And you also start check your own BP, because most of you are 18 years above. So you should also check your sometimes thyroid problem also. 30 to 40% women are having thyroid problems. So BP, sugar, cholesterol. So and this is the nutshell of the blood side. And this boy, is our second year fellow. Started all these videos he has composed it. So he has used artificial intelligence for the yes. Any doubts? Whatever voice now, any female voice or male voice, artificial intelligence, we have used it. This one, suppose you are using before Advocacy 2007 law, they used to die. They used to come with the books every day, repeated and all. And they used to go to put up. I think by the time this fellow gets a date, this fellow died is over. So nowadays people are getting even the poorest of the poor are getting the treatment for stent or bypass surgery. This one, I think probably the vision of the leaders are important. Particularly, I am a central committee member, but the government of India has also, they should educate the people. People also will be educated. Unfortunately, the government, both AP and also central government, they should start check your cholesterol, check your sugar, every AEDs, automatic electrical defibrillation level. If you keep it, the fellows will be stored. So all these people, BLS, basic life support, as a paramedical workers, you should know. First aid, disparate, statin, immediately patient should be shifted immediately in ambulance or without any movement, shift the patient to the nearby ICC center so that we can save the patient. So time is very, very important. Half an hour patient reach. So recently, almost 15 years, 20 years, Psychological College principal, he got a chest pain. He is not revealed to the wife after 16 hours or 18 hours, 20 hours. So he has climbed one stage and he has collapsed and died. So time is a muscle. So damage will be more.